for our churches and our families to be informed and proactive so we can get back to the original foundations our nation was founded on. Every Tuesday at 10 a.m. Central Standard Time on MTM Broadcasting.
Hello, friends. It is I, Brando, from the Intern Brando Lunchtime Show, where we play your favorite pre-2000 Christian hits, along with stories both serious and silly, historic and heroic from around the world. Join our family on Tuesdays and Thursdays, 11 a.m. to 3 p.m. Central Standard Time. And I'll see you then right here on mtmbroadcasting.com.
Trials and Triumphs, a program that takes a hard look at the hard topics with Pastor Laden Bough.
Good morning. I'm Laden Bough from Stockton, Missouri, and I want to thank you all for joining me today on Trials and Triumphs here on MTM Broadcasting. I wanted to take a moment, though, here up front and say happy birthday to my grandson. Today he turns 1 year old, so happy birthday, Daniel. This week I want to talk about detransitioners. There's a lot of them, despite what the media, our government, the alphabet mafia, and so forth, and our schools want you to believe. The Bible says in 2 Corinthians 13 and 8, "For we cannot do anything against the truth, but only for the truth." The lie being told to our children, be they 3 or 20, is that they can change genders. A girl can never be a boy, and a boy can never become a girl, no matter what they tell you. The pronoun fetishists, the alphabet mafia, and the medical and psychological professionals that tell you otherwise are liars with a capital L. Further evidence of that can be gleaned from the number of detransitioners and the growing number of detransitioners who are now suing hospitals and physicians for medical malpractice. I am personally aware of at least 5 gender detransition lawsuits, namely Chloe Cole, Kayla Lovedahl, Luca Hine, Prisha Mosley, and Soren Aldaco. Because of the growing list of detransitioners who are finding the courage to speak out, I predict there will be many more lawsuits coming. Among these, I think, are Kat Cattinson, Abel Garcia, Laura Becker, Daisy Strongen, and David Bacon, all of whom deeply regret the irreparable harm done to their bodies. Others who fell for the transition lies include Matt Ray, a friend of mine who is detransitioning and is currently working with videographers and others to tell his story in an upcoming film called Leaving Amy. It is being produced with the help of Gays Against Groomers and discussing the medical damage done by the use of cross-sex hormones, which has led to physically debilitating pain, nerve damage, tics, Tourette's syndrome-like outbursts, heart damage, etc. A group on Reddit called Detrans is one that I checked out, where detransitioners share their experiences much like a support group. As of August 10th, the group has 54,000 plus members and is growing. Now, most of the rest of this is going to be specifically regarding Chloe Cole. Chloe Cole began transitioning at 12 years of age. She describes being sexually assaulted during her 8th grade year and subsequently began binding her breasts shortly thereafter. At age 13, she was prescribed the puberty blocker Lupron, and 1 month later she started testosterone injections, which she continued for 2 years. It got to the point of doctors performing a double mastectomy when she was 15 years of age. Less than a year after her double mastectomy, she began detransitioning. Chloe has filed a medical malpractice lawsuit against Kaiser Permanente and a number of the doctors. I have discussed Kaiser Permanente frequently on this show and the ease with which you can get gender-altering surgeries, cross-sex hormones, puberty blockers, etc. The Dillon Group, Law Group represents Ms. Cole, and on their website is a case review which states, Quote, "My teenage life has been the culmination of excruciating pain, regret, and most importantly, injustice," Cole said. "I have been emotionally and physically damaged and stunted by so-called medical professionals in my most important developmental period. I was butchered by an institution that we trust more than anything else in our lives. What is worse is that I am not alone in my pain. I will see to the fact that the blood and tears of detransitioners like myself will not lay waste. It is important for me to recoup what I have lost, but I will ensure no child will be harmed at the hands of these liars and mutilators," unquote. Quoting the Center for American Liberty's CEO, Harmeet Dillon, one of her attorneys, they said the medical system shouldn't dictate the future of young children's lives. Through its legal action, the professionals involved will be held accountable for their despicable plot to mutilate children and financially benefit from it. We will break the cycle of them breaking our children before it's too late," unquote. Defendants, the physicians in Kaiser Permanente, also falsely informed Chloe and her parents that Chloe was at a high risk for suicide unless she socially and medically transitioned to appear more male. Chloe had been informed by her parents that defendants even gave the ultimatum, "Would you rather have a dead daughter or a live son?" Chloe will be seeking punitive damages based on the evidence of malice, oppression, and fraud. The letter of intent on this lawsuit was sent to various physicians, hospitals, and Kaiser Permanente, and it is available online. That letter states, quote, "On June 2nd, 2017, Chloe first expressed confusion regarding her gender to her primary pediatric care provider. Chloe was 12 years old. At this visit, she reported having gender confusion as young as age 9. She reported having attraction to males and relating more to males than females. She expressed that males were less judgmental than females. She also had prior diagnoses of ADHD and disruptive behavior disorder. On November 20th of 2017, Chloe had a visit with endocrinologist Dr. Francis Mayatukase Ho, MD, who advised against beginning hormone therapy due to Chloe's young age. She also had a visit with a social worker named Krista Schmidt. Chloe expressed that she had social anxiety and that her mood feels low at times. She reported that her mood fluctuated between a 3 and a 9 out of 10. On December 27, 2017, Chloe received a second opinion from Dr. Lisa Christine Taylor regarding her gender confusion. Dr. Taylor was willing to begin masculinizing hormone therapy despite Chloe's young age. Dr. Taylor prescribed Lupron Depot to interrupt and stop Chloe's natural progression of puberty, which is an inadequately studied and off-label use of the drug. Chloe received the first dose on January the 10th of 2018. On February the 12th, 2018, defendants purportedly obtained an informed consent document from Chloe to begin testosterone hormone therapy. There is no separate informed consent form obtained for the off-label administration of Lupron Depot. Although the signed consent form claimed that it had included a statement of all known risks pertaining to this experimental therapy, the form contained no specific information regarding the actual risks of the testosterone and puberty blockers. For example, the form failed to mention the known risks pertaining to puberty blockers and testosterone treatment of permanent fertility loss, painful intercourse, impairment of orgasm, reduced bone development, and inability to obtain peak or maximum bone density, stopped or stunted widening and growth of the pelvic bones for reproductive purposes, increased risk of osteoporosis and debilitating spine and hip fractures as an adult, increased morbidity and death in older age due to increased risk of hip fractures, negative and unknown effects on brain development, emotional lability such as crying, irritability, impatience, anger, and aggression, and reports of suicidal ideation and attempt. The form also failed to identify risks noted in the testosterone drug labeling, including serious cardiovascular and psychiatric adverse reactions, increased or decreased libido, headache, anxiety, depression, and generalized paresthesia, premature closure of bony epiphysis with termination of growth, causing inability to reach full heights for adolescents, and pulmonary embolisms, and that is blood clots in the lungs. There is a study of transgender men in which all of the individuals who reported adverse drug reactions reported cardiovascular events, and of those reports, 50% of cases involved pulmonary embolism. The labeling also notes risks of liver dysfunction, stating that prolonged use of high dosage of androgens has been associated with development of hepatic adenomas, that's benign tumors, hepatocellular carcinoma, cancer, and pilosis hepatis, generation of blood-filled cavities in the liver that may rupture. Also, all potentially life-threatening complications. Specifically for females, studies of transitioned females, i.e. trans males, taking testosterone have shown a nearly 5-fold increase risk of myocardial infarction. Females can also develop unhealthy high levels of red blood cells, occurring in Chloe's case, which create an increased risk of cardiovascular disease, coronary heart disease, and death due to both. Other effects include irreversible changes to the vocal cords, abnormal hair growth, and male pattern balding of the scalp. Additional risks include polycystic ovaries, atrophy of the lining of the uterus, and increased risk of ovarian and breast cancer. The form failed to identify any of the foregoing risks, which are not exhaustive, and the informed consent discussions with Chloe and her parents fell utterly short of properly advising them of the relevant risks. Furthermore, the form and informed consent discussions failed to identify that there have been no long-term controlled follow-up studies involving hormone treatment on children of Chloe's age, and there are many substantial and unknown risks in addition to the foregoing identified risks. All this can be found also in the lawsuit against these doctors, Dr. Taylor, Dr. Lee, Dr. Watson, the Permanente Medical Group, Kaiser Foundation Health Plan, and Kaiser Foundation Hospitals, in the lawsuit entitled Cole v. Taylor et al. Perhaps of greatest importance, the informed consent form did not discuss, and Chloe and her parents were never informed of the high rate of desistance for children diagnosed with gender dysphoria. Also, they were never informed of the high probability that Chloe's gender dysphoria would resolve as an adult without hormone or surgical treatment. Along the same lines, Chloe and her parents were not informed of the option for psychiatric treatment and care involving either a watchful waiting approach or an approach that attempted to treat the underlying psychological conditions to bring about a mental state congruent with Chloe's biological sex. Instead, Chloe and her parents were provided with the opposite information. They were informed that the only way to resolve Chloe's gender dysphoria was to proceed with opposite-sex hormone therapy and surgical intervention. Chloe is informed that defendants presented Chloe's parents with misleading statistics about transgender suicide and gave them the ultimatum, would you rather have a dead daughter or a live son? This ultimatum was given even though Chloe was not deemed to have any suicide risk prior to beginning puberty blockers. In sum, there was a complete failure to properly advise Chloe and her parents of the serious risk of undergoing this permanent treatment that amounted to medical experimentation on Chloe. Nevertheless, Chloe began weekly doses of testosterone, which lasted more than 3 years. Chloe also had 3 more injections of Lupron Depot, puberty-blocking drug. Based on defendants' advice and recommendations to continue with so-called transitioning, Chloe consulted with plastic surgeon Dr. Hop Nguyen Lee, MD, in or around July 2019. Therefore, she had additional consultations with thereafter she had additional consultations with Dr. Nguyen. I don't really know how to pronounce that, but it's spelled Nguyen. During this time, Chloe's psychological condition worsened. Chloe's mother even requested from Chloe's pediatric care provider a BOT for intermittent leave from school for Chloe because Chloe had been having a lot of mental health issues for the prior several months. Despite this worsening psychological condition, defendants elected to proceed with permanent, irreversible transition surgery. Dr. Susan E. Watson, Ph.D., performed the perfunctory pre-op psychological evaluation and recommended Chloe for surgery. On June 3, 2020, Dr. Nguyen performed a radical double mastectomy, removing both of Chloe's breasts. Similar to the testosterone treatment, the medical file contained a vague purported, quote-unquote, informed consent document that fails to explain and elaborate the risks and effects of the surgery. Chloe was shocked and unprepared for how cut up her chest looked after the surgery was performed. She was never shown any pictures of negative results before the surgery, including of what the surgery looked like in other people in the several months following the operation. Most importantly, she was not informed by Dr. Watson or Dr. Nguyen that her gender dysphoria, the condition for which she was receiving the surgery, had a high likelihood of resolving without undergoing such permanent mutilating surgery. Instead, these relevant facts were intentionally concealed and opposite facts were fraudulently represented. Thereafter, Chloe began to regret the transition hormones and surgery she had undergone. She realized that she was not a male. She realized the hormones should never have been administered, and that the surgical intervention should never have been performed at such a young age. She has severe regrets about receiving this experimental, irreversible medical treatment without proper informed consent, if it is even possible to give such consent as a minor and at such a critical time in her life and development. On May 28, 2021, Chloe expressed regret to Dr. Taylor regarding the transition, and at a later date to Dr. Watson and Dr. Huff. Chloe stopped taking testosterone. She had speech therapy to try to make her voice more feminine, but it did not work. She had laser treatment to remove excess hair growth on her body, and she expressed concerns about whether her body would ever return back to normal, whether she would be infertile, whether she had developed endometriosis, and whether she would have bone problems, etc. She is devastated that she will never be able to breastfeed a baby. She now has a substantially increased risk of having long-term fertility issues, and it is unknown whether her fertility is permanently adversely affected. Her voice is now at a lower pitch and is not as feminine, which greatly troubles her. Several of her female physical attributes were negatively affected, causing her extreme emotional distress. This includes the loss of her otherwise healthy breasts and the stunted development of the female curvature of her body and face. She is also at a substantially increased risk for future health issues because of the ill-conceived puberty blocker and hormone treatment she has received. The primary basis for assessing liability is defendant's treatment, advice, and recommendations that Chloe undergo a puberty blocker, masculinizing hormone therapy, and radical surgical removal of her breasts, recommending, supervising, prescribing, and advising inadequately studied off-label high-risk treatments on Chloe between 13 and 17 years of age, amounts to medical experimentation on Chloe and represents gross negligence and an egregious breach of the standard of care. Furthermore, defendants concealed the significant likelihood that Chloe's childhood gender dysphoria would resolve by adulthood without chemical or surgical intervention, and fraudulently represented the opposite proposition, namely that such chemical and surgical interventions were necessary to resolve Chloe's gender dysphoria. These concealments and fraud also represent a breach of the standard of care and a failure to obtain informed consent. Chloe is a biological female diagnosed with psychological issues including gender dysphoria, ADHD, and disruptive behavior disorder with expressed social anxiety and feelings of low mood. It has since been discovered that Chloe is also on the autism spectrum. Anyway, back to the letter. Chloe did not have any diagnosis of a physical nature that would require hormone therapy treatment, and she had no diagnosis of a physical issue such as breast cancer that would justify an invasive and permanent removal of her otherwise healthy breasts. Her hormone levels and breasts were operating and developing normally for a child of her age. The treatment that defendants prescribed does not comport with the appropriate standard of care for children such as Chloe. There have been no controlled or long-term comprehensive follow-up studies demonstrating improved long-term psychological and or physical health of children and adolescents who undergo such treatment. Furthermore, at least one long-term population-based study in Sweden found that gender dysphoric individuals receiving sex reassignment, including hormone treatment and surgery, have substantially higher suicide rates than the general population. In other words, receiving sex reassignment hormones and surgery does not materially improve the well-being of gender dysphoric individuals, as they still experience extraordinarily high suicide rates. Furthermore, multiple studies demonstrate, and it is largely undisputed, that the majority of cases of gender dysphoria that present in children resolve in adulthood, as in fact occurred in Chloe's case. Furthermore, Chloe's psychological condition worsened after she received the puberty blockers and hormone treatment and prior to the double mastectomy being performed. Yet you decided to press forward with the transition despite the decline in her psychological well-being. Furthermore, Chloe had no significant indications of suicide or severe depression, and she had no other psychological factors or conditions that would justify recommending such an extreme and experimental course of treatment. The standard of care clearly mandated a wait-and-see approach in Chloe's case. The defendant's decision to treat Chloe with drugs and hormones and surgery that cause permanent damage and mutilation represents gross negligence and intentional fraudulent concealment. And even in agency-driven groups that support these experimental treatments, excuse me, such groups generally acknowledge the lack of adequate long-term studies with these types of treatment. Furthermore, current medical experimental models, including the most prevalent Dutch model, do not recommend hormone treatment before age 16 and do not recommend surgical intervention before adulthood, in large part due to the high frequency that such issues will resolve by adulthood. Additionally, there are no competent models for predicting which case of gender dysphoria will resolve by adulthood. Furthermore, Chloe was never evaluated to be at high risk for suicide, a popular reason touted by proponents for this treatment as a justification for early experimental treatment on children. Consequently, your treatment of Chloe put her on puberty blockers and testosterone hormones at age 13 and a half, and recommending and advising breast removal surgery at age 15 represents a breach of the standard of care even by experimental treatment standards. Finally, it is quite clear that the informed consent forms and discussion regarding these treatments were highly deficient from a standard of care perspective and constituted intentional fraudulent concealment. Although the hormone therapy consent form contained an affirmation by the patient that, quote, the information in this form includes the known risks and effects, unquote, the form fails to meaningfully identify any risks of hormone therapy and puberty blockers. There is an exhibit on the Exhibit A in the lawsuit discusses that. As noted above, there are extensive documented known risks for such treatment, none of which were included in the form. The informed consent form was for the breast removal surgery, identified some basic risks of the surgery and loss of ability to breastfeed. However, it failed to disclose the experimental nature of the surgery and the lack of long-term studies for performing this surgery at such an early age as treatment for gender dysphoria. That's in Exhibit B of the lawsuit. Both consent forms also entirely failed to inform Chloe of the significant probability that her gender dysphoria would resolve by adulthood, resulting in severe regret and harmful physical changes to her body that can never be reversed. Furthermore, defendants never verbally advised Chloe of this potential risk. To the contrary, defendants advised Chloe that her gender dysphoria would only resolve if she underwent sex reassignment hormones and surgery, which proved to be false. This inadequate consent and defendant's failure to properly advise Chloe and her parents of the associated risks and the experimental nature of the treatment represents gross and reckless negligence and is an additional breach of the standards of care. The Kaiser Permanente medical groups, hospitals, entities, and facilities, including those named in this letter and those whose names are unknown by Chloe at this time, are liable for the foregoing acts of their providers. These institutional defendants are additionally liable for allowing such radical, inadequately studied, off-label, and essentially experimental treatments to occur on minors, including Chloe, at their facilities. They are also liable for failing to have adequate policies and procedures prohibiting and preventing the acts, omissions, failures of informed consent, fraudulent concealment, fraudulent misrepresentation, below the standard of care treatment, and other issues that occurred in Chloe's case as described in this letter. Indeed, the institutional defendants not only have inadequate policies and procedures in place to prevent such treatment, but they actively promote, encourage, and advertise on their website that their facilities and providers offer transgender treatment, including for minors. Consequently, these institutional defendants are jointly liable with the providers, but also have additional and separate basis for incurring liability for Chloe's damages. As a result of the grossly negligent treatment that you have performed, Chloe has permanent, irreversible mutilation and damage to her body, particularly the female characteristics of her body. The full scope and extent of her physical damage is currently being investigated. Nevertheless, a non-exhaustive summary of her past symptoms and ongoing issues is summarized here. Based on Chloe's medical records, she has had medical diagnoses indications for hypogonadotropic hypogonadism, hyperandrogenism, hypoestrogenemia, erythrocytosis leading to increased cardiovascular risk, and an abnormal complete blood count. Additionally, Chloe is 2.5 inches shorter than her predicted adult height, and she is about 4.5 inches shorter than the maximum predicted height that she may have attained had she not taken testosterone. So, as you can see, there's a lot of issues involved with this, but that's all we have time for today. Next week, we will continue to look at the other lawsuits currently pending as a result of the mutilation of children who did not have the capacity to give informed consent. So I thank you for joining me today on Trials and Triumphs. If you have any questions or comments, please drop me an email or comment on this broadcast. If you would like to contribute to offset the cost of my research, you may do so via Cash App or Venmo at Ladena Bough. That's LadenaBough. Thank you again for joining me, and have a blessed week.
To contact Trials and Triumphs, you can email Pastor Ladena Bough at trialsandtriumphs2@gmail.com. For more information, find Trials and Triumphs on Facebook and her podcast on Buzzsprout, as well as X under and Trials 56454 or Instagram under Pastor Ladena Bough.